I'm asked every day about the risks of facelift surgery, and the answer is there are very few risks of surgery. We have generic surgical risks that we encounter with every procedure that we perform, things like visible incisions, prolonged healing time, infection, but the good news is those risks are very, very few. Typically, the most significant thing that we'll have to do to optimize incisions is to perform a very light laser resurfacing after facelift surgery, and recovery typically takes 5 to 7 days. The only risk that I'm concerned about after facelift surgery is something called a hematoma, and that's a collection of fluid or blood under the skin that must be drained. Typically, that will occur in the first 24 to 48 hours after surgery. I tend to see that in about 1 out of every 75 to 100 patients. So it's not rare, but it's not frequent. The treatment involves simply placing a small needle in the collection of fluid and aspirating that fluid and replacing the bandage. Some of my best results are people who have had hematomas in the early postoperative period. So the good news is this shouldn't affect the long-term result of a facelift in any way whatsoever. We do our best to minimize the risk of hematomas, but the fact is that they do happen somewhere around 1%, 1 in 100 to 1 in 75 patients. They do occur, but the management is very straightforward. This is why I keep in very close communication with my patients during the first 24 hours following surgery.